accepting any more Medicare or Medicaid patients. And some, well, they've just given up altogether. And that was before Obamacare. So will the president's health care law make it even worse? Joining me is Dr. Martha Boone, a urologist whose Atlanta practice is struggling. Dr. Sujatha Reddy, who's a gynecologist, also in Atlanta. She stopped accepting Medicare and Medicaid. And Dr. Franisa Hall of North Carolina, who left her medical practice because it was just too hard to make ends meet. And it's great to have all of you here. All right, Dr. Boone, let me start with you. First of all, welcome back. Good to have you back with us. What's the toughest problem that you're having right now?
We're concerned about keeping the doors open. 2 days ago, a 38-year-old woman came to me who had lost her gynecologist and her primary care doctor. I took the time to phone her physicians and ask them, and they had both gone out of business because of low reimbursement from Medicare and Medicaid. So probably the toughest thing we're facing right now is decreasing reimbursement while we're having increasing cost of doing business.
You know, Dr. Reddy, a lot of people don't understand that a patient comes in who's Medicare, Medicaid. It's not like if it actually cost you $100 to go through the procedure that you're going to get $100 back. Those are fixed costs that the government decides no matter how long it takes, no matter what you do. Is that why you quit taking Medicare, Medicaid?
Reimbursements are definitely part of it. Medicare doesn't pay as much as commercial insurers. But the bigger problem with Medicare was the bureaucracy, the regulations, the coding. Whereas every other insurance company has one code for an annual checkup, Medicare has a completely different code, and there are other codes you have to add to it to get to the same level as everybody else. So we would have to basically employ separate people who are experts to handle just Medicare when everybody else can do everything else. So it was the regulations really, and the bureaucracy of it is it's huge.
Now when you talk about codes, well, we get those, forms from our doctor and it has all those little numbers on the side. That's what you're talking about. Codes, right? 08, 064, all this stuff by whatever the procedure is. We don't pay any attention to those numbers, but you better pay attention to those numbers, haven't you?
You absolutely have to know how to code because that's where your bread and butter comes from. And it's just very frustrating with Medicare because the coding is completely different and often very cumbersome and not logical compared to commercial insurers.
You know, Dr. Hall, I cannot imagine how hard it is to go through medical school. I mean, it's not just college, and then you go through medical school, and then you, have an internship, and then you go through a residency, and you're years and years and years into an education process, get your medical license. I can't imagine it's so frustrating that you say, I just can't keep doing it. What was the breaking point for you?
The breaking point for me was exactly what they're talking about. I'm a primary care doctor. And when I started out, I had 15-minute slots for appointments, and it was 2 15-minute slots for a physical. I couldn't keep a viable business seeing that many patients. So I cut it to 10-minute slots, and I still couldn't make ends meet. Now, the way I was trained, I need to spend time with my patients and get to know them as a person because their personal life has a direct impact on their health and their sense of wellness. And so in order for me to take good care of them the way I was trained, I needed more time. But I couldn't get more time because I would go out of business. And so instead of waiting to go out of business, I decided, you know what? I can figure out something else to do.
Wow. I want to ask each of you very quickly, if you could tell me the percentage of time that you spend treating patients versus dealing with bureaucracy, paperwork, and the administrative side of medicine, what would the percentage breakdown be? Dr. Boone.
I'm spending much more time since the Affordable Care Act came into place. As of October, we started becoming penalized if we weren't on an electronic medical record. So it turns out that I'm probably spending about 25 to 30% of my time complying with the government regulations because I'm still trying to play by all the rules and keep all of my patients. So 25 to 30% of my time is spent filling out paperwork.
All right, Dr. Reddy?
Maybe a little bit less because we don't take Medicare. We're lucky we have enough young patients that we haven't had to take Medicare for a while. But I think the new regulations are definitely going to add to the time. And then realize these regulations change. You know, we have a whole new coding system that's coming out, ICD-910, so we have to learn a whole new system. Or have to pay a lot of employees to learn that whole system. So again, a lot of time and money is going to just keeping up with the regulations that are currently there. I can't imagine how much worse it's going to get as we have another layer on top of it.
Dr. Hall, what kind of percentages were you dealing with when you were practicing medicine?
Well, I would say at least 15 to 20% of my time was just on administrative responsibilities. I had a solo practice, and I was primary care, so there's not a lot of margin. And so I was doing a lot of things myself. I had an office manager that was wonderful who took on more of that responsibility. But, you know, what happens is you finish your day seeing patients, and then you do this other stuff. It's not like you can work this out during the day. So it starts to impact your personal life. You know, and so you have less and less time for your family, or less and less time for music, or whatever it is your other pursuits are.
You know, and I think that's what's really part of this that people don't understand. When we come back, I want to talk about the solutions, because we've diagnosed the problem. So how would these doctors treat the problem that has been at least exacerbated by Obamacare? We'll ask them when we come back.